I'm Candace Michelle, and this is Our Community. There's been a lot going on in the past couple of months at every level, from national to local, from personal to professional, with things happening that we couldn't imagine a couple of short years ago. I find it exhausting just trying to keep up with the daily barrage across the spectrum from the micro to the macro. The only cold comfort is that if that describes your reality, you're not alone. Many of us are right there in the trenches with you, reminding you to take your vitamins and drink plenty of water. One of my favorite guests joins me today, Diana Carter. Diana is the executive director of the local organization Brookings Core Response, which helps connect people in our communities who are in need with the services available here to help them. Welcome back to the show, Diana. It's so good to see you.
Doesn't it feel like it's been like a year to get to that sentence? Welcome back. It just was like, we're here.
Finally, Diana's back.
Yeah.
Yeah, I know. It feels good to be able to look across the table and actually see your face.
I don't even see you really anymore. We're both just so incredibly busy.
I know. I mean, there are Zoom meetings and there are phone calls, but yeah.
I mean, prior to, I guess, maybe even the last 6 months or so, it was pretty constant. There was at least once a week some communication.
Absolutely. I know. I was thinking just the other night, when was the last time I talked to Diana?
It's weird.
I know.
It's like, when did I call my mom last? Exactly. Only for me, I don't call my mom. So it would be you.
Exactly.
So yeah, it's been a minute to get here.
It has.
And that's mostly, been not my fault, but certainly my stuff going on. I just haven't been able to come back. So
And frankly, it isn't just you.
No.
I mean, I've done less and fewer interviews because my time is wrapped up with my husband at this point, who is disabled, and I have to be there a little bit more than I was, and
amazing. We get to a point where we're like, I don't think I can give anymore, and then the world is like, we need actually twice as much from you,
right?
And I guess I'll give more.
But where? Where do I get it from? My husband asked me the other night, don't you have another plate? It's like, because I kept saying, my plate's full. Well, don't you have another one?
Well, I don't have an assistant, so I do have kind of an assistant,
right?
She needs and she actually has an assistant, and her assistant needs an assistant,
right?
So
there are no extra plates.
No,
there really aren't. No. I know, it's crazy. So, how are things with your organization?
Oh man, it's kind of a weird place because we're so busy. But we're not, this is the first time where we're not doing something new right now. I mean, yes, there are some slightly new things, but, it feels like every year we're adding a couple of programs and a building and, 5-6 new staff. And this year, we did add staff this year. In fact, we just had someone started today. Well, maybe yesterday, but, and so we are now up to 18 staff.
Wow.
But this is the year where we've sort of, Beth used to talk about this, and I've heard this a lot in ED work and organizational work that, I think it goes for everything, businesses, whatever. But the pattern is sort of, what is it? You form and then storm and then norm.
Oh.
And there's probably some others that
I like that.
But, we formed in the beginning and then we stormed. We've been storming for a while. And now we're trying to norm. We're trying to make everything just sort of automatic and boring almost, so that things are running smoothly and we can catch the glitches. So it's a bit of a different mindset. And some of my staff who've been there for several years, everybody's really good about change in our org because it changes all the time.
Yep.
But it's just we're all shifting our focus now away from the storming to okay, what new desk procedures do we need what have we been doing that we need to write down in case we need somebody who's never been here to just get on board and do. Yep. So it's a lot of putting in some stabilization infrastructure, mostly through policies and procedures. And we're taking some time to get a lot of consulting in different areas. I mean, so much education right now for all of our team. We spend so much time in training and education right now. I'm sure that there's a point where they just don't want it anymore. But we have a lot to learn to do the things that we're about to do. And so this year has been a little bit more norming. We're going to do some more storming next year because we have a few programs we'd like to get on board. And some programs we're still working to get online, including the Veterans Project, which has hit a delay. We don't anticipate that it'll be done now until closer to summer of next year, which is really unfortunate because we're about to hit the winter. We're already hitting the rains.
Yep.
Like it's already
Yep.
turning cold. You can feel it.
Yep.
So I don't know what we're going to do about that because now that we've shifted from doing the temporary emergency shelter to the long-term shelter, we have less beds. But we do have an opportunity to potentially open up more shelter space. And I know that the city of Gold Beach would like to hear a plan from us about supporting their campground and really putting some framework around it and some stability around it for the people that are there and the community. So that has been on my plate, but I haven't even gotten to it yet. And so I need to spend some time working with the city of Gold Beach on some of that. So that, and then we are looking to, I'm looking for grants currently and other information to open up childcare next year.
Ooh.
Yeah, that would be, I mean, I would have loved to have been able to open up this year, but we had several things come our way.
Yep.
So next year, that's the plan. Try to find some funding, purchase a new building because, or a separate building from the locations we have because we really want this to be specific to childcare. We want it to be standalone for childcare and scale.
There's a huge need for that here, isn't it?
Huge, yeah. It's something close to, what is it? 1 in every 16 children that need childcare has a spot. And that's not even really good data.
Wow.
So we have a huge need for childcare here. And I'm sure you can imagine there's more than 16 kids needing childcare.
Yep.
So,
Yep.
yeah, and part of why I want to go into expanding for childcare is not just the need, because we already know that's there. We see it, we hear about it, but we also feel it when we're trying to move, families through the shelter. And part of that is them being able to work so that they can afford to move in. We can move them into a place, but they can afford it afterward. And a lot of them can't work because they can't find childcare. And so this would solve problems for us too, and for our staff who struggle to find childcare.
Yep.
Self included.
Yep.
So it is a big need, but outside of just the need, like for space, there's also a need, and I'm not disparaging any of the childcare agencies here or any of the childcare centers here, because there are a couple of individuals, and I think they're small businesses that do childcare here, and they're fantastic. That's what people use. And so we're definitely not looking to take anything away from that. But what we do want is we want to have a larger licensed childcare facility so that we can accept state payments for that, if there's still state payments by then. Yeah. So that we can accept the state payments and make it sustainable for people and for us, and, kind of create that as its own program. So that's a lofty goal.
I love it.
I think licensed childcare facility, when I called my mentor and who is a guru when it comes to licensed childcare facilities, really any childcare facilities, he runs the YMCA in Medford. And so he knows, they offer Child Watch, which is just 16 hours a week. It's just sort of like, the parents are either on site or nearby or whatever. And it's not licensed. And so but you only get 16 hours. And he also has preschool, and then he has summer camp. He has a youth center. They have long-term, day childcare. Yeah. So they have multiple different programs, a lot of experience. And I called him up and I said, hey, I'm thinking about, I said, am I crazy? Because I'm thinking about doing childcare. And he said, you're absolutely crazy. But we will come in and support you in that endeavor.
Yes.
So the intention, I think, is for us to start with Child Watch, which anybody from the community would be able to utilize. It would be sliding scale. Obviously, the people that we're working with are low income enough that it would likely be full scholarship. In fact, I'm positive it would. And then to be able to offer that a sliding scale for staff as well. And it's not full-time childcare, though. So that would allow us to get a building, start setting up, get some support in there while we're building it, and get some experience as well. And then move on to licensed childcare from there. So
I think that's great.
possibly end of next year. That may be lofty, but that's my hope.
But the kids are our future.
Yeah.
And as we get older, those of us who are on that end of the spectrum, it's really, really true.
Yeah.
And the mental health as well as the physical health of our children is paramount.
And in this community, even if you have a good support system, and I don't just mean like people you can call if you are stressed or if you need a ride to the doctor or something, but if you have parents, grandparents, aunts and uncles, usually family, but maybe close friends that can just take your kids in, that's probably your best setup, because kids need, strong adults in their life that are going to guide them in the right direction. And the fewer adults that you have in your life reinforcing those same ideals and the healthy boundaries and all of that, the more likely you are to push back against that when it's just your mom or just your dad or whatever, especially when they're teenagers. And I can personally attest to this. They know everything at that age. They just know everything. I know nothing.
That's exactly right.
And you kind of need a support system to reinforce those things as well. And childcare, what I really appreciated about the YMCA when I worked there, and I also utilized all of their childcare services. What I really appreciated, that aside from just knowing my kids were in a safe, healthy environment, is also knowing that the adults around were reinforcing the same things that I was. And, kids don't even notice that these things are being reinforced. And so I think that a child care center here would help out a lot of families that don't have those support systems, which is a lot in this community. It really is. People are quite estranged from their families for various reasons. So that
would make a big difference in the children's lives, I think.
That's the hope.
I read something the other day that said if we get through the current situation that we're in and still have a intact country, that one of the things that we should do is make sure that we have civics classes.
100%.
Starting in kindergarten, going all the way through college. So that there's constantly a reinforcement of what does it mean to live in a democracy? What are your obligations? What are your responsibilities? What are your rights? What does it look like to be in a participatory form of government? Because we've lost.
I think that
so much.
And when you're informed on a certain topic and you're hearing other people who are uninformed be so confidently wrong in some of these topics, it does make you wish that these specific topics were taught at a younger age. But I think really all we would have to teach people from a young age is how to be curious and how to do research.
Right.
Because most of the people that I run across don't know how to do effective research, which is linear research. It's not just pulling up a tab and asking Google. It's not just watching some YouTube videos. Even if you did you could spend weeks doing hours and hours of research, reading papers, watching videos, and still come away with the wrong information if you don't know how to do research, if you don't know the basic principles of research. And so I think that is something we should teach kids, because that will carry them in every topic, every conversation. And so the more people we can get to say, I don't know, but I'll get back to you on that.
Right.
It's just a basic skill I think we should all have.
And it's not what to think, it's how to think.
It's how to think. That's
how to think.
How do you find the answers to what you're looking for?
Right. And
how do you keep a mindset that just because you think it, that doesn't make it fact.
Right.
That's something we
Inquiring
definitely,
minds.
yeah, we definitely don't have that a lot, and it certainly feels missing in this day and age.
Yeah,
So
no, it really does.
everybody's an expert.
And there's this whole thing of, if you belong to a certain group, you think this certain way, and it's really just
Well, there's groupthink, and then there's the people that do research to justify their own arguments,
Right.
which is
confirmation bias.
confirmation bias.
Yep.
Mhm.
Yep,
So
exactly.
a lot of folks, when they do research, it's if you're trying to figure out why Joe Blow is, just you don't like him, you could literally Google and just be like, why is Joe Blow a bad person? And you will find information to tell you why he's a
Yes.
bad person. Same way if you said, well, why is Joe Blow such a good person and a great human and whatever, and you'll find that. You will.
Yep.
So it'd be better to ask, what type of person is this person, or
Yep.
what is their history? What are they, are they in Congress? What are they historically voted on?
Right.
So there's a lot more questions that we can ask in a more
That are not
neutral way.
loaded questions.
Yeah,
You go
which is
in
why you
with
should
a-
know how to do research. Like,
Exactly.
what is the purpose of what? Why did they write what they wrote? Why did they write this article? Was it to convince you of something? Was it to sell something?
Right.
There's just some basic questions I think we should be teaching people when they're reading information.
And it can start at a very young age.
Oh yeah.
I mean,
my
there's
kids
no
are.
reason
Yeah.
why not?
I
yeah.
definitely talk to my kids
Yeah.
about this.
Absolutely.
Yeah.
All right. So back to core.
Yeah.
So you've got a couple of things in the works.
Yeah.
How are you seeing any effect on the dysfunction and the shutdown in Washington? Is any of that stuff trickling down?
Yeah, it's in different ways and at different times, and so some of it is feels pretty immediate, and then some of it we can just see the writing on the wall and try to brace for things. The shutdown has directly affected us because we, lovely timing, have received our very first federal grant.
Oh no.
And so, in fact, when they were talking to us about the grant, I came back and I was like, actually, we may need to turn this grant down. It's with everything going on in the federal government right now, it just feels, and I'm not the only one that thinks this. This is, I communicate with a group of executive directors all over the country and some of them all over the world. There's probably a good 9,000 directors in this group, and we have these conversations all the time. And so the general consensus is that it is not stable or a safe bet to communicate and work with the federal government right now. We still are, but it doesn't feel safe.
Right.
And that's totally the opposite of how we've been historically. It's always been clunky and difficult, and those grants are the only grants that have made me cry. But it's always been steady, solid. And so when you get it, you get it. I mean, they're going to audit the hell out of you, and they're going to, you better cross all your T's and dot your I's. But it's there and So now what they're saying is, we're actually this grant, you've got this grant for a year, which is a 2-year grant. They're saying, well, you have this grant for a year now, and then you have to, it's going to be a new competitive process. And so we aren't sure we're going to get a renewal of these funds in a year. What they're supposed to be, this grant in particular, is a grant that once you get it, it's almost guaranteed you're going to get it again. As long as you don't make mistakes and the auditing turns out well, you're probably going to get it again, because they don't like to do a lot of work giving out these grants. And if somebody in your area is already getting it, they want to continue funding them to do the work, unless there's a reason not to.
Right.
So it's a highly competitive grant, and we were awarded the grant. Not that anybody else applied, but we were awarded the grant. And I mean, that doesn't mean that they gave it to us by default. It was very strict requirements. I mean, again, this is the only grant that's ever made me cry. 2 years in a row.
So sad.
Yeah, it's just.
But I know what you mean.
Oh, it's the worst, because it's not even, writing grants is not the problem. Then they're like, okay, everything needs to be in this format, this size, this spacing, but these documents need to be in this, and these need to be in PDFs, and then we need pictures. It is insane.
Yes.
And then you need to do it in their portal, which doesn't make any sense. It makes no
doesn't
sense.
work.
And they also say it doesn't make any sense.
Yeah.
So It's not great. And we went through all that trouble, though. We got it. We are already using it. We're already working on, it's a housing grant. But this particular grant, typically, once you get it, you're in the running. Every year you can request more even. And so this was this is the first time Curry County is directly getting this federal grant. And so we're very proud of that. And it's supposed to just renew every year. And now they're saying, that it may not renew, that it may be a more competitive process. I don't know how it can be more competitive. But what it sounds like to me is they're saying, we're going to make you compete with all the agencies across the state now, which makes zero sense.
Yep.
0 cents, because an agency over in northeastern Oregon is not providing housing services in Curry County. So if they go through with this, Curry County may lose this housing funding. I will tell everybody it's a very small amount right now, like very small. It'll only house a few households, but it's a foot in the door. And this was, we don't need it, which is why I considered turning it away. But to house a few more families, of course.
Yeah.
We will jump through the hoops for that.
Exactly.
But now we're not even sure that it's something that will be sustainable in the future. So that's new. That has less to do with the shutdown, though, and more to do with other factors at HUD and the federal government. I think it's more the appropriations. And then the shutdown itself, though, we did get the grant. And so we have to go through this whole process of, the systems that the government uses, and there's a lot of them. You have to be in multiple systems for one grant. You have your narrative reportings, you've got your finance reportings, you've got update, sections for updates, where you file your original grant, where you renew it. Like, there are so many different systems and paperwork so we're slogging through that, and we're just about at the end of it, and then the shutdown happened. And so the last email we got from our HUD rep was just a flood of documents that we needed to finish and get done. And she was like, here's everything. I might not be in for a while if the shutdown happens tomorrow. And so just do what you can until I get back. And so we have been. And then, of course, yes, she's not in. I called her the next day and it went to a message. And so I called the HUD number in the federal line, and I reached someone in DC, and they were like, well, we can only help you set up your password and whatnot. And so she said, you need to reach your field office rep. And I said, well, she's furloughed. And she said, yeah, I know. And that was it.
Wow.
She said, just whenever she gets back. So we actually can't even get reimbursed for this grant, even if they were doing reimbursement. But it sounds like they still are reimbursing for this grant, but we can't even get reimbursed because we can't get into the system yet. And we're spending money, but we can't get into the system until the shutdown's over.
Which could be, who knows?
Who knows?
Yeah, exactly.
So we're kind of like slowing down just for a second on that. I mean, it's a very small amount, but still. So that's how it directly impacted us. And we're just one agency with one grant. Like, my colleagues around the country they don't have access to a lot of what they need to do their jobs. And I can only imagine the chaos that it's having. We're all experiencing it, though.
Yep.
It's just in different ways.
Yep. I worry about the whole medical stuff.
That's big. That's the big one. I mean, there's several big situations happening, I guess, here. But I think the medical piece, the tax credits, Medicaid, the ACA, I think all of the changes that are happening is what's going to tip the boat, because everyone is being affected.
So tell me about that, because I know what I read.
Yeah.
But, premiums and ACA and I mean, there's so many moving parts.
Yeah. Well, so the ACA, most people know, came into play really around
Affordable Care Act,
yes.
otherwise known as Obamacare.
Right.
Yes.
So that really came into play. I mean, it was voted in 2010. It really started coming into play in 2013, 2014. That's when a lot of the provisions were set to take effect. Some of those were challenged. A few of those only partially went into effect. But for the most part, 2014 is when all the provisions kind of were in effect. And that expanded Medicaid, or I guess what I should say is it allowed states to request an expansion of Medicaid. And because previously Medicaid was only available to you if you were in, serious condition, you had a disability, children with, if you're under a certain income. And it was just super stringent guidelines. And so if you are a healthy, middle-aged man, you're not going to qualify if you have any income at all. And so that's sort of that's the base Medicaid rulings, or I guess policies. And then when the ACA happened, it allowed states to request an expansion of Medicaid funding, and that funding went towards other populations. States were able to expand their populations, and they have quite a bit of leeway over that. So Oregon is one of the leading expansion states. We not only have taken the expansions, we've applied for other waivers that have come online. The 1115 waiver, which is it's essentially a waiver where you're saying we want to experiment with this pot of money and not use it for what typically it's used for. We want to use it for this over here because this is how it'll support people's health. And then the federal government reviews it, and it's a whole process. It took years for Medicaid in Oregon to accept to be able to implement the 1115 waiver.
Wow.
The 1115 waiver is it's HRSN, and it's health-related service needs. And there are 4 categories. One is outreach and engagement, which is just connecting with people who have Medicaid and seeing what their needs are, seeing if they're having a problem paying their rent, if they're needing food, things like that. And then the other ones follow up with that. So there's a food benefit, and that's like getting additional food boxes for certain populations. There's more that they're going to roll out. It's been a several-year rollout. There is rental assistance, which we offer all of these. So if you come to court, or if you need, I guess I should say, if you have Medicaid, any Medicaid in Oregon, and you're struggling to pay your rent or you're about to get kicked out, either way, you can come to us. You can call your CCO. We'll help you walk through the process of getting the rental assistance. And it's essentially an eviction prevention program, but you don't have to have an eviction letter. So, and I do more of the admin side of it. So definitely my case managers on the ground could tell you a lot more of the nuanced information. But if anybody needs that, they can certainly call or come in and ask. And then there is a benefit for devices. So like an air conditioning or an air purifier or stuff like that. I can't remember what they call that. But so there's a couple of different benefits. This is something, paying for rent, Medicaid paying for rent, that's definitely not in the general, Medicaid rules. And so this waiver was basically a waiver of those rules for this pot of money. And I believe that the state even gets a little extra money on top of that specifically for this waiver.
It makes sense, right? Because if you are a member of a vulnerable population and you're getting basic health stuff, but you're about to lose your housing, your health is going to be impacted
That's why,
severely.
Yes, that is 100% why. And you can't use these benefits for people who are without housing. These are benefits for people with housing. That was one of the arguments, I think, early on. We were like, why are you limiting it to this? But I think that's their argument, is that we are paying so much money for the health care of people who do not have housing. And it's not because they go to the doctor all the time and they're using up all these services all the time. It's because they don't do any of that preventative care because it's hard for them to coordinate. I shouldn't say they don't. A lot of the folks that we work with often do not. There are definitely people that do, and people who are really on top of their health. But most of the time we see people who are in such states of trauma or just dysregulation and disconnection from supports and systems that they haven't seen a doctor in 20 or 30 years. So they are costing the healthcare system a lot because they're typically going to the emergency department.
Right.
That's where those costs really fly. They're taking a lot more risks with their health. That equates to more costs to all of us, the public.
Yep.
So if I pay someone's rent for $900 as opposed to them going to the emergency room for $2,000, it's cheaper. It's cheaper for all of us. So they say in public health, they say an ounce of prevention is worth a pound of cure.
Yep.
And that's what this is. It is health insurance. It is health care to
Right.
pay somebody's rent when they're in that situation. So these are just ways that Oregon itself has expanded Medicaid. And Oregon is also, I think, Oregon is the only state that does not have out-of-pocket costs for Medicaid members as well. So we're really on the front lines here.
Yep, that's great.
And I think that all of the expansions under the Affordable Care Act were to allow states to be a little bit more creative because they recognized healthcare wasn't just going to the doctor. It included a lot of preventative care that we didn't have before. And like I said, it allowed states to expand their populations to essentially whoever they wanted. So that I can't remember how we got off on all that, but
Well, we were talking about
that's-
Medicaid and
yes.
like how that was being
Yeah.
impacted by.
So basically now, and there's two things. There is the we need to pass the new bill or the new budget, and the reason why that budget is being held up is because of the tax credits, and that those are set to expire at the end of the year. And in fact, I think it's just the end of 2025. And so if those aren't renewed, and this was through the ACA, so if those aren't renewed, then people's insurance premiums are going to go up. So that's one separate factor. We can definitely go into all that. The other is the big, beautiful bill. So that has another impact. So that's called H.R. 1, the Big, Beautiful Bill Act. And that has a pretty devastating impact on a lot of the people that we serve, but also a lot of the people that I suspect we will be serving in the near future. They are on Medicaid and are going to potentially lose their Medicaid.
So are they getting cut off? I mean, are they? What's happening with?
So Oregon, it's just Oregon. Essentially, there is a provision that I think was through the Affordable Care Act, but I don't actually know that, that essentially allows the states to charge, it's a cost to providers and hospitals, and that cost, it's a tax, and that cost goes into a bucket, or that money goes into a bucket, and the federal government matches our state dollars. So whatever we allocate to Medicaid, the federal government matches up to a certain percent. And most, and this is data driven, most Democrat-run states require a much lower match percentage than most of the Republican states that aren't able to. They have not expanded Medicaid to bring in these. They have not accepted extra federal dollars, and so they require a higher match. So they're getting those dollars anyway, but they're not applying it to additional populations. They're barely covering the people that they serve. And there's a lot of reasons for that. It's pretty nuanced, but most blue states really are only at about 50% match. And I think that Kentucky, Mississippi, Wyoming, actually I don't know about Kentucky, Wisconsin, Tennessee, South Carolina, all of those, they have chosen not to. 10 states have chosen not to expand Medicaid since the ACA. So the provider tax goes into the bucket, and the states typically use that provider tax as a match. And so that provider tax is what has been eliminated through the Big, Beautiful Bill.
Oh.
Eliminated. So I don't want to misspeak. I think that it's that they're going to eliminate expansion of it's called the FMAP, Federal Medical Assistance Percentage. They're going to put a cap on that, and then they're eliminating these taxes or eliminating the expansion of these taxes. So they can still keep the same tax level that they have for providers, but they can't expand it, which means when we see any growth, we can't mitigate that. So those are kind of some pretty big ways that it's going to impact the state's budget. They're going to have to find a way to come up with the funds for the match without without raising taxes for the providers. So the state's going to have to offset that. for Oregon, it's roughly $3 billion
Oh,
that they're going to have to offset. Yeah.
wow.
So I think that one of the ways that certainly Oregon could do nothing, and they would probably lose enough funding where they would have to lower the federal poverty level amount that they cover, which during COVID went up to 200%. And this is all very confusing for most people. And so it's kind of hard to explain in a way that makes it a little bit easier to understand. But basically, Oregon's going to have to make up a $3 billion deficit, or they're going to have to cut services, cut Medicaid for most of the population. It's roughly 83,000 people are projected to lose insurance just with that alone.
And we're not talking about undocumented workers.
No, there are no.
These are our residents.
You cannot, if you're undocumented, you can't. And I guess I don't know what. If you have a green card, there are definitely different rules for this. But if you're undocumented, there are only two forms of coverage that you can get. And that's if you're pregnant, which I think we would all agree we don't want pregnant women, regardless of their citizenship, dying on our streets. And we want children to be healthy, regardless of where they come from. So that's one. The other is so the emergency Medicaid. So we do have an emergency Medicaid option, and that is obviously that's just for emergency care. You can't use that for urgent care. You can't use it for primary care. And emergency care is where our costs go up. But here's why this is a better option than somebody going in without insurance. First of all, most of them wouldn't, go in unless it really was severe. And so some people would actually, the mortality rate would definitely go up. And if you don't care about that, sure. But the uninsured is what costs people money. It's not the insurance. It's the uninsured costs that cost all of us money. And we can see that in a lot of the red-run states because they have so many uninsured individuals and they have such high emergency room costs. They have lack of preventative care. And we're not even offering all of this to undocumented workers. We're saying if you're pregnant or you have emergency room visits, it's very limited. It's very limited, and it's not what people think it is. So, and it's even more
amazing that there is so much mis and disinformation out there about this.
Well, and that is state funding that is used for undocumented, because states can use their funds to cover it, but that's state funds that they're using to cover it. And I realize, the argument can be made that comes from the federal government, from our taxes and all of that. But the state also has their own match and their own income for Medicaid as well. So not quite 50, or it's not quite 1-to-1 like that.
And is Medicare being impacted as well? I guess it would be. I mean, if you have, there's the basic Medicare, but for a lot of us who are on Medicare, we also have supplemental insurance because there's a lot of things that Medicare doesn't cover.
Right.
And I know that the premiums are going up.
Like Medicare itself, I haven't seen any direct hits on Medicare itself. The supplements, certainly. And Medicare will be affected. It's just that there's nothing that directly targets Medicare that I've seen yet. But I also don't read everything.
Right.
I do have a lot of knowledge on health insurance, but mine primarily focuses on Medicaid and some private care. But we do work with Medicare as well. And so I am somewhat familiar, but I personally haven't seen anything directly targeting Medicare. But it will be affected because it's kind of hard when you implement a lot of change, like a lot of healthy changes to your insurance system, when you include and incentivize a lot of preventative care, that's the biggest one. Incentivizing preventative care has really changed how Oregon's money is spent. And that's why we're able to spend money on housing. It's because we do a lot of preventative care. That's one of the pieces that Oregon has implemented.
And it makes a huge difference in people's health.
And it does. And so when people's health is better, their productivity is better, your overall community is better. That expands to your state. That expands to your federal government. The ripple effects from that. And that also affects the providers on the ground that are working there. They have more time for others. They're able to, it's just not as much emergency care and follow-up.
Right.
And so all of that affects Medicare in ways that we can't even see most of the time.
We don't.
I mean, some of us understand on the back end how that works, but to the regular person, it would not make sense. So there are going to be some effects from Medicare if we don't if we don't continue the tax credits, and we continue on with this HB1 that is essentially tearing apart some Medicaid. Then there are going to be effects later for Medicare that people aren't even going to attribute it to this. And they're going to be like, well, it didn't affect me.
Right.
My stuff happened because of this.
Right.
It's all affected. All health insurance.
So the premiums are the things that are going to go sky high, right?
Yeah.
I mean,
so
it's starting already.
The bill's already in place, so that stuff's already happening. The tax credits that it is going up already. But right now, they're just projections based off of what they're seeing the federal government do. So if they were to see that the federal government was working hard on a solution to extend tax credits, nobody would be projecting these numbers. But they're already projecting them because they already assume it's going to happen.
Right.
So most people will see they will see that their premiums triple. That's just most people.
Wow.
I have an individual that their premiums are going to go up by 10 times.
Oh.
So going from under $150 a month to $1,300 a month. So that's
you can't
unprecedented.
afford.
No, their plan is to just drop insurance altogether. And this is a elderly person.
Yeah.
Not elderly. Certainly not old, but older, should have health coverage for sure, and is going to have to wait for health coverage until they're 65 and qualify for Medicare.
Oh,
so
it's just brutal. It's brutal.
And if you get anything, so there's something that we talk about in health insurance called ambulance insurance, and this is not insurance for ambulances. What it means is that, so prior to the ACA, what we had a lot of people saying, well, I'm healthy. I don't need any of this. So they wouldn't pay into this insurance system. And then something would happen. They'd get diagnosed with cancer. They would break a bone. Something would happen, and they would need not just emergent care, but some urgent long-term follow-up or short-term follow-up. And so they would get on insurance right then. And what's happening is they're not paying into a system that they are now benefiting from. So that is why the ACA expanded to require coverage from everybody, because it was actually hurting the people who do pay for the people that are like, my premiums are so high, blah, 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 and now we're all required to have coverage. That's to lower your premiums. I can't say that it worked well since then, because they also eliminated, they kept the requirement, but they eliminated the penalty. So it has no teeth.
Yeah.
So there are a lot of people that just dropped insurance. The only teeth that it has is that there's these other things that you won't qualify for, but there's nothing they can do. It was supposed to be a fine and some other things, and they dropped that, and it probably rightfully so if it went before the courts, and that's what they decided, because we don't want to be obstructed by our own government. However, what that means is that now we still have a lot of people on ambulance insurance. It did bring down premiums, though, significantly. We're seeing stuff go back up, but I think that's more political. And insurance is just always going to be expensive. We have a huge insurance problem already in America. And, we could go into capitalism all day, but it's not just health insurance. It's liability insurance.
Absolutely.
It's everything.
Yeah.
It's vehicle insurance. It's home insurance.
Yep.
And so we have a big insurance problem already. And it is certainly not the fault of the ACA and the expansions that brought insurance rates way down for a lot of people, because people started getting covered. It started requiring workplaces to cover their employees if they have so many employees and all of that. So more people got covered, costs went down for everybody. That's how it works. That's how health insurance works.
And if you've got a healthier population,
Yeah.
you just have a healthier population. Yeah. Things work better.
Well, health insurance itself is sort of a byproduct of the system that we have. It wasn't necessarily built into the system. It's a byproduct of the system we have which it's a good thing. So in, the early 1900s, that was when we originally started getting our very first like health insurance type stuff. And Blue Cross was the first. It was they were based, they're religious based. So most of our healthcare and health insurance and everything that we do are college courses for doctors, all of those things, all of that started in the churches. And because churches were tasked with helping the less fortunate, and they got pretty good at doing it.
Yep.
And so what they realized is pretty quickly is that in order for us to have doctors that are trained, and they're all trained similarly, and they're all providing similar care, we need to have standards. And so they implement standards. And then people have to go to school to get their doctorate to be able to provide that care. And then we got hospitals, set up. And people didn't want to go to hospitals at first because they attributed it to the poor and the dying. But then we got penicillin, and things started getting better. Because it's amazing how science works.
Amazing.
And then people started utilizing the hospitals and getting better care than they were. And we could, instead of a doctor running around all these places, which I kind of hope we do get back to some degree of that. But there's also a huge benefit in going to one building and getting all of this. And they're all there and they're all ready and they've got all their stuff with them. But that costs a lot of money to run that. And so the hospitals and the doctors and these providers weren't able to provide that consistent care because they didn't know if they were going to be able to keep the lights on. So health insurance was a byproduct of our current health system because it was a way of saying, everybody put your money in. We're going to pay for these things, whether we use them or not, to make sure they're there when we do. And as a result of that, they've used that money to further advance medical science, and we've gotten more than just penicillin.
Right.
So health insurance itself is just a byproduct of what we built with doctors. We didn't have a standard of care before the 1900s. There was no certificate. Somebody could just operate on you. And just say that they knew what they were doing.
Oh dear.
And then other doctors who felt like they had a handle were like, this is not how we want. So we want health insurance for everybody because it's how we share the cost. And I recognize that some people have a higher cost than others, and some people should not have those high of costs. So it is a problem, but getting rid of these expansions is the opposite direction that we want to go.
Yeah, we want a healthier population.
Yeah.
I mean, that's the
preventative
whole point,
care,
right? Exactly.
Consistency in our healthcare.
Exactly.
And we, here in Curry, we know all about inconsistency in healthcare because look at our pharmacy situation.
One pharmacy.
Yeah.
One.
Yeah.
I mean, did you see the line yesterday?
No,
I stood in that line.
Oh, God. They really should put out chairs now.
I know.
Those poor pharmacists and everybody back there.
I
know.
I
think most people have been very patient with everything. But again, I remember a time here in Curry where there were only a couple of doctors you could see, and they were all over the age of 60, and they were all men. And if you were a 17-year-old pregnant girl like I was, you didn't really feel comfortable there.
No.
And so we need more consistency, and this is just going to take us in the opposite direction. So I am really concerned about it. We're definitely keeping an eye on it. The tax credits are going to affect, millions of people, tens of millions of people that are on health insurance countrywide. So this is a big problem.
When do you think the citizens of Curry County are going to actually start to see something?
Oh, they already are.
Are they?
People are seeing the cost that's going to start next year of their premiums. People are already canceling their insurance.
This is not something people want to do. They don't want to be without insurance.
No, but they don't want to pay $1,300 a month. I don't even know how you could.
No, they can't.
Because I'm not talking about, people with second, third homes.
Right.
We're talking about, my colleagues, people that make as much or less money than me.
Yep.
So it's very concerning. The tax credit is available to people who most people with low to moderate income, they're able to get their health insurance in Oregon. Well, No, this was through the ACA as well. The health insurance marketplace was implemented through the ACA, and um, we have people who disparage the ACA that they don't even know that the fact that you can sit down and compare insurance, you could not do that before the ACA. You would have to do investigative research. And then even then, you may not get all the information. They weren't very transparent. Now you can pull up and compare plans.
Wow.
You couldn't do that before.
Wow.
The marketplace where you can just go shop for a plan, yeah, nothing like that. We didn't have tax credits. We didn't have sliding scale. We didn't have any of that. You either qualified for Medicaid or you just didn't have insurance.
That's amazing.
Unless you were wealthy. So the fact that you can find the best rate for you, could you imagine if you I'm like trying to even think of an example that would be as important as and as relevant as this, as shopping for health insurance. But I think that's probably our health is our most valued resource.
It's your life.
So I'm not even sure if there's a metaphor I can use for this.
Yeah.
But yeah, to be able to sit down and compare and make the best decision for you is because of the ACA. Prior to that, you sat with a broker. And I have to tell you right now, you can still sit with a broker. And guess what they're going to use to find the best health insurance? The ACA. I had this conversation with a broker.
Yeah.
And they were disparaging it. And I just called them out. And I said, because this is what I study.
Yes.
And I said, do you realize the only reason we are even able to sit here and have this conversation right now, that's paying your paycheck, is the ACA? And this person did say, well, yeah, that's true.
Interesting.
Very interesting.
Yes. Yeah.
So even informed people, I don't know why they have this idea that the ACA is the cause of all of their problems.
Yep.
We have a lot, when it comes to health insurance costs, there are a lot other problems that are contributing to that, not the ACA, not the expansion,
and
not
again,
the tax
it's
credits.
misinformation, it's disinformation, it's where do you get your information, how are you looking at the information to find out what's actually true and what isn't true, and
Yeah.
and again, we're not talking about people who can afford to, spend thousands of dollars a month. We're talking about people who are just getting by. And so they're making a decision, right? Do I buy food or do I?
Yeah. And so with the elimination of the tax credits is definitely going to be a big impact. People are going to feel that much more than they're going to feel the impacts from HB1. But that does not mean the HB1, that one's just going to take, it's a slower rollout. And they did that intentionally because when you're rolling something out slow like that, people sort of forget some of the stuff along the way.
Yep.
And they also don't attribute everything to that. It's so slow that it's hard to really pinpoint where it's coming from.
Yep.
But we know.
Yep.
Those of us who study it, we know. We already know what it's going to cause. And so when it causes that, we know where it came from. But it's really hard to kind of relay that information. And honestly, Oregon's going to have to either, due to the bill, they're going to have to either restrict eligibility, lower the income cap to the 138% of the federal poverty level we had before. Childless adults are not going to be covered. That's just, if you make any money and you don't have children, you're just not going to be covered. We're going to go backwards. So that's if they don't do anything, that's what's going to happen. They could limit covered benefits or provider payments. That certainly would help, but it would definitely conflict with our health equity goals here in Oregon. So that's an issue. And then the third option, which is really the only option they have, is to raise state revenue to maintain the coverage. And so I think there is precedent for this because we've instituted different types of taxes. They're called sin taxes, taxes on tobacco and alcohol and things like that.
Yep.
We've been really successful at implementing those taxes. And I get that, my sister was a smoker. Of course, she complained the whole time, but she also voted for it too, those increase in taxes, because she understood.
Yeah.
And she did eventually end up quitting smoking. So, but I think that's what they're going to have to do is in order to maintain the current provider rates and the current coverage, they would have to raise that money. And the only way I can see that happening is through sin taxes because we have precedent. We have a process for it already in place. So it wouldn't take anything. yes, it would cost money to do, but overall, we would be more sustainable, I think.
So, Diana, I hate to tell you this.
Yeah, it's so crazy. How
I know
quick.
it goes so fast.
I'm like, I should have stopped. There should have been other things I left out so I could include it. There were more important things.
Well, obviously, you're going to have to come back next week so that we can continue because I did not get even half of the stuff.
And maybe I can better formulate some of the pieces in the bill, the HB1 that are spelled out in there and what that's going to do, and maybe I can.
Plus, another week down the road.
Oh, who knows? We could be.
Anything can happen, right? I mean, we could be
I
at,
hope it's
at
good.
war with Venezuela.
Yeah.
I mean, I'm looking forward to that.
Well, that's going to impact our health.
It certainly will impact mine.
Yeah.
All right. Well, I want to thank you, obviously, for taking the time out of your crazy life, because I know your life is easily.
I came in hot today.
You did come in hot, as did I.
Yes, you did.
Yes. But thank you so much for taking the time to come in here and keeping us informed. And we're going to need that. We're going to need that on a
Well, I'll try to be
continuing-
a little more put together next time.
And so will I.
Yeah.
And thank you to, you and your wonderful staff for all the stuff that you're doing for those.
Yeah, they're great. They're
us.
so great.
And there are a lot of people in our community who are community members who are vulnerable people. And I think we forget that. It's so easy to pigeonhole people.
Yeah. And housed and unhoused.
Exactly.
I see a lot of housed folks, elderly housed folks for the most part.
Yep,
Yeah.
exactly. So thank you so much. And you really do make a huge difference.
Thanks.
Well, and I want to thank our listeners for tuning in. Remember that it does take a village. You're not alone. Stay connected and stay hopeful. I'm Candace Michelle, and this is Our Community.